Today, we have Dr. Alejandro Diaz, who is a pediatric allergy and immunology specialist. And we're going to focus on a new disease that I never knew about until recently, which is interesting. We've been in practice, both of us, for many years, decades. And all of a sudden, there's a new disease springing up called alpha gal syndrome. And it's even more interesting because it may have a nefarious background to it. So, welcome, Dr. Diaz. And can you just give us a brief overview of what alpha gal syndrome is?
Dr. Bowen, thank you so much for having me on your show. It's a pleasure to be here with you. And so basically, alpha-gal syndrome, it's a delayed allergic reaction to a sugar molecule that it's called galactose alpha 1,3 galactose, hence the name of alpha-gal. And this specific molecule, it's placed on the surface of cells of mammals, except humans. And this is very unique because the problem that triggers this disease are ticks, specifically the Lone Star tick, which is very common in the Midwest of the United States and East, North, and South. That's that's uh, that's exactly what it is, the alpha-gal, and it's a fairly new disease. It was first diagnosed by an Australian doctor, Dr. Van Noonan, in 2007, and then up until 2008 by Dr. Thomas Platts Mills at the University of Virginia. And it's very interesting how they find out what was going on with these patients. But we can go on the overview about that.
Well, so did it originate in Australia? You said an Australian doctor discovered it.
2007, yes, by Dr. Noonan
Okay,
in
because
2007.
there are some theories that it's coming from, bioweapons research in Plum Island, and
Yes.
but it sounds like it was possibly originated in Australia, or is it just it happened to we had a smart doctor there that figured it out in Australia?
So basically, what happened with Dr. Noonan in Australia, I think it was Sydney back in 2007, she started to recognize some patients that they were having severe allergies, but they couldn't figure it out until she found that it was because of this molecule, this specific sugar. But it was up until 2008 where the team of researchers from the University of Virginia with Dr. Thomas Platt Mills that they were starting to see something very interesting, Dr. Bowen. They were starting to see that a lot of oncologists, and they was back, I want to say like 2005, 2006, they were starting to see this severe reactions on patients that they were treated for cancer, specifically with cetuximab, which is an anti-monoclonal antibody that is used specifically for the treatment of colon cancer and neck cancer.
Mhm.
They were starting to see this through, colleagues in oncology and so on, but they couldn't figure it out. It was up until the smart team of Dr. Platts Mills in the University of Virginia that they started to see like a pattern, very interesting pattern. They started to recognize that most of these patients, they were living in the states of North Carolina, Tennessee, Arkansas, and Virginia specifically. And they say, well, this is not random. This is region specific. And they say, well, what is so unique about this place? And then they started to recognize that it was heavily embedded with specific ticks, specifically Lone Star tick. Then they started to do their research and they found that number one, that cetuximab, this monoclonal antibody used for this cancer specifically, it's made with the conjunction of galactose sugar. That's number one.
Oh, interesting.
Number two, they were able to find that many of these patients, after they were ingesting red meat, they're starting to have reactions. So they found out that many patients that they were treated with cetuximab eating red meat, they were previously sensitized by tick bites. And the tick bites, what it does at the immune system level, it produces a sensibilization and produces specifically IgE, which is the main antibody that it's formed during the anaphylactic reaction or allergic reaction. So when the patient that it's already sensitized with the tick bite, and either they are injecting them with cetuximab or they're eating red meat, they can develop this severe allergic reaction that up to 60% of the patients, they found out that they can produce an anaphylactic reaction. So just for the audience, so they understand what an anaphylactic reaction is, that is the most severe allergic reaction that any patient can have. And it can go from swelling of the eyes, swelling of the tongue, the throat. It's hard to breathe, hives, difficulty breathing, lowering in oxygen, elevated pulse, lowering in blood pressure, and so many other signs and symptoms. And the patient, if the patient is not treated properly and immediately, the patient unfortunately can die. So that's what's going on with alpha-gal syndrome.
Is it similar to anaphylactic reactions you see with peanut allergies or seafood allergies? Is it similar in that respect?
Great question, Dr. Bowman. It's not. This is what it's tricky. It gets tricky. So usually allergists like myself, when we are seeing patients for an anaphylactic reaction, this is what we call immediate reaction. Immediate reaction can go from a couple of minutes, 5 minutes, 10 minutes, at the most 30 minutes. There are some delayed reactions, some specific foods and medications and so on and so forth, but will never go after 1 hour. It will be within the first minutes.
Mm-hmm.
And then you start seeing all the signs and symptoms, which are the cascade of events that are happening in the body. And you, as a physician at the ER, you have to take actions immediately, with epinephrine, clearing the airway, oxygen, corticosteroids, antihistamines, H1 blockers, H2 blockers, and the whole deal. There's, you have to be well trained in order to help a patient with an anaphylactic reaction. But when it comes to the alpha-gal syndrome, it's very interesting because it's a delayed reaction. We're talking about sometimes up to 6 to 8 hours after they consume either the cetuximab or the red meat. And it can come from cow, deer, pork, lamb, you name it. But it's very interesting. So basically, the pathophysiology that it has been naming in the literature is that when the tick bites the mammals, because they feed on the bloods of the mammals, they get embedded their saliva in their salivary glands, and there's a transformation, very interesting transformation with proteases, histaminases, and some tryptases, and so many other what we call immune modulatory substances. When it gets transformed and the tick bites somebody, they will inject that transformed alpha galactose sugar, and then that will sensitize the patient, and the patient will produce the specific IgE.
And just to clarify, it's only mammals. So chicken and fish, those patients do okay with that kind of protein source.
Correct. It's only mammals. Basically, we're talking about the most common because they're fed on the ticks feed on this type of mammals through the blood. Cows, pork, pigs, deer, lamb, um, bison, and meats like those kind of meats. So they're highly consumed, and so that somebody who has been sensitized already with this ticks and developed specific IgE for alpha galactose, they have their antibodies. Whenever they encounter again with this molecule, this sugar, they can react. But that it's a very delayed and very atypical reaction.
What we I wonder, do you think mosquitoes could transmit this since it's sort of the same thing where you've got this insect spreading and injecting different people?
The only vector that we know of us today, 2025, are ticks, specifically the Lone Star tick, which is very common in the Midwest and Northeast and Southeast of the United States. It's hard to see on the West Coast, alpha gal syndrome patients. At least they have been living in the on the East Coast. It's very interesting. It's very region specific.
Are these ticks that live on dogs, deer? I mean, are they animal specific, or are they, like the deer ticks tend to?
It's more related to cow ticks,
Mhm.
deer ticks, pig ticks. Uh, Basically, those are like the most common. But it's the interesting part here that we can analyze is that why it takes so much. I mean, usually an anaphylactic reaction, it's immediate. It's what we call an immediate reaction. But this is kind of, I want to say, kind of engineered
Mhm.
type of reaction. And this is when it gets complicated. You know, uh, this is when conspiracy theories come to the table. There's a very interesting book that it's called Bitten
Mhm.
by Chris Newby, and she talks about what happened during her own experience with Lyme disease. And she explained the possibility of bioweapons in Plum Island, in Long Island, New York, and then also in Lab 257. So all this, what happened during the Cold War, this military experiments with ticks and different animals and so on and so forth. So she thinks that Lyme disease, as well as West Nile virus disease, and so on and so forth, kind of escape from Plum Island. So
Mhm.
it's when it gets very interesting. And then if we think about it, Dr. Bowden, if we think about it, we have been eating and we have been eating meat for thousands of years. We have ticks for thousands of years.
Mhm.
What have changed? I mean, what is the common denominator here that we have to think about it? And as we know, uh, the foundation of Bill and Melinda Gates, they have been investing large amount of money in a lot of research when it comes to ticks and mosquitoes. And there is this new trend that they want to diminish gas emissions through through cows and cattle. And I wouldn't be surprised if there are some people interested in trying to diminish the meat consumption.
Mhm. Do you think they're developing a vaccine for alpha gal syndrome?
I wouldn't be surprised if that is on the way. You know exactly what happened during the COVID operation. I was very vocal at the beginning of the COVID operation, and I said, I wouldn't be surprised that they will create a vaccine, and look what happened. 5 years aftermath, 5.5 billion people got injected with those toxic injectable products of experimentation, so-called COVID vaccines.
Yeah. How do you test for alpha gal?
You send blood work to the lab and you will test for specific IgE antibodies against alpha gal, which is the fraction of galactose alpha 1,3 galactose fraction of that molecule. And then you'll have the results and you will see if that patient has been sensitized with the alpha gal sugar molecule through a tick bite.
And then you said it was initially identified in 2007. Is that right?
First time ever, if you go to the literature, first time ever, it was identified in Sydney, Australia by the Australian doctor in 2007. I think it was Van Noonan, Dr. Van Noonan in 2007. But it was up until 2008 when the team of Dr. Uh, Platts Mills that he was able to put all the pieces together, and he found out that actually it was through the alpha gal
Mhm.
sugar.
And then what can you tell us sort of the numbers since then? Is it exploding or how fast is it becoming a problem?
So let's say the first article that it was written by Dr. Thomas Platts Mills, it was in 2008. By that time, they were able to identify approximately 22 patients. But then afterwards, every 6 months or 8 months or 9 months, it was tripling and quadrupling up to this moment, which is 2025. There are estimated around 450,000 cases of alpha-gal syndrome, which is it's an explosion of cases.
Can it hit any age, any gender, any race? Is it more common in certain
It's more common in
demographics?
adults. In
Adult?
adults,
Mhm.
basically patients who have been exposed to ticks,
Mhm.
that they go outdoors, they do a lot of outdoors activities. It's more common in that population. But I think the number it's incredible. I mean, we're talking about exponentially
Mhm.
450,000 cases of a very kind of weird and strange disease. I wouldn't be surprised that it will be some engineering behind this, as well as Lyme disease and West Niles. There's no doubt in my mind that SARS-CoV-2 was 100% engineered and it was a bioweapon. I don't have a doubt in my mind, and I've been talking about this for 5 years in different forums throughout the world. But now we encounter with this kind of new disease I mean, it's basically a matter of putting the elements on the table, starting the conversation, then people, they will make their own conclusions.
Well, so I see a lot of allergy patients. I'm an ear, nose, and throat doctor. What would prompt me to order this test over the typical allergy patient?
So basically, the way that you can come to the diagnosis, it's through, as you know, Dr. Bowen, through a good medical history, physical examination, what happened, when happened, exposition to tick bites. That's important, very relevant. And then the physical examination, and then send the lab work of specific IgE to alpha gal. And then if it's sensitized, there's no question that specific reaction that they had. It's important to mention that not all patients will develop anaphylaxis.
Mm.
Up to 60%, which is extremely high, will develop anaphylaxis, but 40% not. So the signs and symptoms can range from hives,
Mhm.
angioedema, uh, rash, GI problems like diarrhea, isolated problems, different organs and systems. But when you get the anaphylaxis, which is the whole spectrum of the allergic disease, it's when the patient will get your attention. So it's not an easy diagnosis.
Yeah. Wait, for the 40%, you said 40% don't have anaphylaxis. Is that right?
40% don't. Yes.
What kind of symptoms do they have?
Mostly hives, angioedema,
Mhm.
GI problems. Basically, it's very unique for those patients that they haven't developed the severe reaction like anaphylaxis.
So
But
now,
it's hard to make the diagnosis before you get the anaphylaxis because hundreds of different causes can create
mhm.
those symptoms.
Yeah. But maybe not, if they're just complaining of postnasal drainage and runny nose, that might not prompt you to dig into alpha gal. It's more the skin manifestations and GI tract and sort of unusual allergy symptoms. Is that fair?
Exactly, exactly.
Yeah.
Yeah, and then obviously during your medical history, it has to it it has to be related to eating meat,
Right. But you
which
said
is
there's that
very
delay. So that's why I think it's a little tricky because
it is very tricky.
it's not like peanuts where people know immediately. Yeah.
I've been practicing allergy for so many years, and I haven't seen a case.
Oh, you
This
haven't.
is kind of fairly new to me as
Yeah.
well, but I'm very surprised and you know, understanding what happened after the COVID operation, I'm not surprised of anything else now at this
Right.
point in time.
Yeah.
Anything can happen.
What can these patients take like a over the counter antihistamine and live a normal life or how are they treated?
So once, let's say the patient reacts to, and it gets anaphylactic reaction, so you'll take care of the patient with the schedule and the regular treatment of anaphylaxis, and you ask the patient not to eat meat anymore or dairy products,
Oh, right.
including milk and cheese can create alpha-gal syndrome.
Oh, wow.
Obviously, meat and beef, most of the reactions, but including milk and cheese. Can you imagine that?
Yeah, that'd be hard.
But I really think, on a personal, this is a personal opinion. I really think that there's something fishy behind this.
Hmm.
I mean, if we understand that we have been eating meat for thousands of years and we've been having ticks for thousands of years, there's no, there's no logical thinking that this could just happen out of the blue.
Right.
So it has to be manipulated at engineering level, genetic manipulation, the only way that I can understand that this is happening.
Well, there's a video circulating around X of, I don't know who it is, but there's some scientist on there talking about how great it would be if we could develop a meat allergy because people don't have self control. And if we're going to save the planet, we need people to stop eating meat. So, wouldn't it be great if we could find a way to make people allergic to meat? Have you seen that video?
No, I haven't, but I'm not surprised. Again, I really think that this is man-made, that this is my personal opinion. I think it's man-made because if you add the book Bitten, the
Mhm.
book of Lab 257 by Michael Carroll, and then you put everything into what happened after the SARS-CoV-2 pandemic, the COVID operation, I call it better. Um, you know, they have to understand that through the manipulation of fear, mass formation, that they can control people with different diseases, infection, communicable diseases, and so on and so forth. Um, I think, this is why we're starting to see more diseases like this. Otherwise, it doesn't make sense.
Right. It is very suspicious.
It is
Um,
very suspicious.
I want to touch on COVID and I want to touch on your vast experience as a pediatrician and your thoughts on vaccines and the changes you've seen in your practice. You have been a pediatrician for how many years now?
Over 20 years.
Okay. So you've seen a lot and you've seen a enormous rise in the number of vaccines over those 20 plus years in practice. Has that enormous rise in vaccines led to healthier patients overall, or has your practice changed with all these new vaccines?
Well, it changed in a negative way, definitely. So when I was growing up during the 70s, in my lifetime, there were like, I want to say like seven vaccines at the most. And you never you never heard about any autistic patients during when I was a kid. Now that I'm in practice for so many years and I have seen the change, even when I was doing my residency, I didn't see that many kids with autism or neurological underdevelopment and things along that line. Now it's incredible. It's skyrocketing like never before. And what is the only different thing is that but we have more vaccines.
Mm-hmm.
So in my when I was a kid, there were seven. Now, if somebody follows and is complying with the CDC schedule, by the time they turn 21, they have injected at least 78 to 79 vaccines. It just does not make sense. And I see it on my patients, with chronic sinusitis, pneumonias, a lot of allergic disease, rhinorrhea all the time, asthma, atopic dermatitis like never before.
Mm-hmm.
And also, the typical kid that it's always coughing with mucus and rhinorrhea, and it's getting sick all the time.
Mm-hmm.
So I don't see a healthier population. I'd see a sicker population after this huge amount of vaccines.
Yeah, so I'm curious what impact you've seen on ear infections because I remember during my training they said, well, this new pneumovax series will prevent ear infections. Are you seeing an improvement in that regard with ear infections?
Not at all. No, I see a lot of sort of allergic disease, ear infections, sinusitis, pneumonias, all sort of GI problems, a lot of autism, a lot of neurodevelopment patients, and it's been dramatic. I just see so how do they get all these problems if they are they're very well taken care of, good nutrition, and so on and so forth. What is going on? And the only answer that I have found, it's the increased amount of vaccines. So we need to ask Dr. Bowman for, at least double-blind placebo-controlled trials when it comes to vaccines. You can ask any average pediatrician, can you tell me, you're a parent, you talk to your pediatrician, you're taken to your first well visit to your pediatrician, and it's time to get their first round of vaccines, let's say 2 months. And the parent can ask, Doctor, can you tell me how bad the disease is that you will vaccinate my kid for? Do you know the ingredients of each vaccine that you will apply today to my kid? Do you know what are the chances of my kid getting tetanus or diphtheria or pertussis or measles, mumps, rubella, hepatitis B, hepatitis A, uh, pneumococcal infections, and so on and so forth, chickenpox, things like that. And, you know, probably 99.9% of my colleagues, they will not have an answer
Mm-hmm.
because they have been trained to push those vaccines.
Well, the one that I get the most questions on is the meningitis shot. And my son's pediatrician, I didn't take him to the visit, and he was 18. So I didn't really have a say in it. But my son's pediatrician told him that if you get meningitis, then there's a 25% chance you will die. And that's how he convinced him to take the meningitis shot. So I don't know if you have any thoughts on the meningitis shot.
Well, that's true for virtually all the other diseases. the risk of getting those diseases are very minimum.
Mm-hmm.
Most of them, with the exception of meningitis, are self-limited.
Mm-hmm.
They're self-limited. Yes, with meningitis, I've seen patients with meningitis. Some of them vaccinated, some of them are not vaccinated, but you have to make a medical intervention, obviously. But the rest of the diseases are self-limited, you
Right.
know, from measles to anything you can imagine. So it's about risk and benefit at the end of the day. So one of the things that I recommend to the parents of young children is try to get as much information as you can. But it's also where are you getting that information from?
Mm-hmm.
The information is very biased because somebody who will try to push these injectable products, they will put the worst scenario. Oh, your kid, higher chance of dying from this disease if you get polio, if you get meningitis, if you get pneumonia, and so on and so forth. So the parent, the only kind of piece of information they are seeing is the chances, the chances of dying, even if it's extremely low. So
Mm-hmm.
they will rather take the vaccines in order to protect their children than not taking the vaccine because it's the way how pediatricians are delivering the message.
Have your views on vaccines changed, or have you always thought this way?
Great question, Dr. Bowman. So, my personal experience. First, the whole route to become a specialist. Go to medical school, you do your residency, and then your subspecialty allergy and immunology. I did a lot of international global health, medicine, traveling the world, understanding about immigration medicine, and so on and so forth. At the beginning of my career, I was kind of indoctrinated. I was biased, but there was something that I said, there's something wrong with all this. So let me put you an example, personal example. I I've been a pediatrician for over 20 years and I never vaccinated a kid in my practice. Never.
Wow.
Not even once.
Wow.
But on the other side of the token, I did vaccinate my kids.
Oh.
But but let me tell you why. Because so what is the typical life of a doctor? You're always busy.
Mm-hmm.
You're studying all the time to get good grades and pass to the next year. And then when you go to the residency, you're overloaded with work, seeing patients at the ER, neonatology, grand rounds, the floor, and so on and so forth. And then you have to do your study for the following day for journal club, and so on and so forth. You have to be busy all the time. You don't have time to think. You don't have time to create a critical thinking, and you have to say yes to everything. So
Mm-hmm.
when my wife called it, hey, it's time to get the shot for the kids. I was busy. I was seeing patients. I was tired. It was 3 a.m. in the morning or whatever. I was, didn't sleep last night. I said, okay, yes,
The path of least
but
resistance. I get it. Yes.
exactly. But it was up until a certain age, and then up to a certain age, I stopped to apply any sort of vaccines to my kids. No more vaccines for my kids. We didn't vaccinate for COVID. It was not a vaccine. It was a bioweapon. It was a toxic injectable product of experimentation. And so now, obviously, my view has changed tremendously,
Mm-hmm.
180 degrees.
Yeah. So have you seen, I mean, let's just put COVID over to the side for a minute. So prior to COVID, have you seen children that were injured by vaccines?
Yes, but I wasn't able to make that connection like completely.
Right.
I knew that something was wrong, and I was seeing patients, and I was seeing a lot of sick patients, but I was not able. I had the doubt in my mind, but I was not able to make that connection, that huge connection, like I am seeing right now.
Did you have pushback from your patients or from other doctors because you weren't giving vaccines?
100% all the time.
Where are you a
They don't like me
solo?
actually. My colleagues, they don't like me because
Right.
they think that I'm delivering a very negative message. but I am 100% sure that I am not.
Have you been public about it your whole career, or just was it just recent, or
Within the last 5 years, I want to say the last 5 years have been like an awakening for me.
Mm-hmm, mm-hmm. And then what, I mean, obviously you didn't give any COVID shots. Have you seen children that have had issues from the COVID shots?
Plenty, plenty.
Really?
From myocarditis to pericarditis to GI problems, neurological problems, a lot of urticaria, angioedema, you name it, everything.
Mm-hmm,
I see a
mm-hmm,
lot of, and unfortunately, especially on adults, patients, a lot of turbo cancers, a lot,
mm-hmm, mm-hmm.
and a lot of, unfortunately, many patients have died that I know of.
Really? Like your own patients?
Yes.
Wow. Wow. And you told me that you travel to Mexico for to practice, right? Your practice
Yeah,
is in
I
Mexico.
have one of my practices in Mexico.
Is it different? Do they have a different um I mean, are the injuries different, or is uptake of the vaccine the same, or
It
are
was
there
pretty much the same as the United
it
States.
is,
It
yeah.
was up to in Mexico up to 78% of the 79% of the population took at least one shot.
Did they have the same kind of mandate situation that we did?
No,
Oh, they didn't.
not that much, but the people they were very compliant,
Right, right. What
very
and
compliant.
what about ivermectin though? Were people taking ivermectin for COVID because it's over the counter there, right?
Yeah, but they didn't know that. There was not enough people talking about ivermectin, hydroxychloroquine, azithromycin, um, uh, all sorts of different medications that help definitely to improve the outcomes. I
Mm-hmm.
was, I don't want to brag about it, but I think I was pretty much the only one.
Right.
There are some other great and amazing doctors, but you have to be on the right outlet to in order to reach out more and more people. But they were very brave doctors in Mexico, very good physicians, very brave doctors. But the message was not very um, loud, let's say it like that. So
Mm-hmm.
not it was not delivered to many people.
Right. What about monoclonal antibodies? Were those used in Mexico?
No, not that much.
Really? Yeah. Probably too expensive, right?
Very expensive. The same with the remdesivir and things like that. So it was very tough. It was very tough.
No. For the kids, yeah, I don't have a huge number of kids in my practice. One that stands out in my mind was a 15-year-old with just horrible rash all over his body after the Pfizer shot. And he had tried, antihistamine, steroids, Xolair, and the only thing that worked was ivermectin. And he responded very quickly, though, within a couple of days. Where I've had adults who same situation, and I mean they've had to be on ivermectin for a month before they even noticed any improvement. I don't know. Are you seeing the same sort of thing?
Yes, all the time,
Mm-hmm.
all the time. And it's it's one of my number one prescription medicine, ivermectin.
Right.
I use it. I use it a lot with incredible results, and I think it's one of the best medicines ever. That's why it won the Nobel Prize in 2015.
What around what dose are you generally starting with in your injured patients?
It really depends, but it can range from a zero point 0.5 to 1 milligram per kilogram.
Mm-hmm. And then I've had some patients tell me their allergies get better on ivermectin. Are you seeing that?
Yes,
Yeah.
yes. It's incredible how it works for specifically for many things, including turbo cancers, definitely with mebendazole and or fenbendazole. But it really works for rosacea, all sort of rosaceas.
Right.
It's incredible how it works.
Yeah. And
It's a
it's
very good medication.
as I'm sure you know, very safe. I mean, I rarely have anybody complain of side effects. The biggest side effect is the cost. Is it easy to get in Mexico?
It's very easy. It's over the counter virtually, and it's not so expensive.
Yeah, yeah. I think the United States needs to follow in Mexico's footsteps.
Yeah.
Are there any other off-label medications that you use for allergies?
Oh yeah. Yeah. All sort of antihistaminics from first generation to second and third and fourth generation antihistaminics, along with every now and then when it's needed, corticosteroids, like for example for my allergic rhinitis patients.
Mm-hmm.
Uh, I use antihistamines, nasal rinse, and also corticosteroids as well
Yeah.
with great results. And obviously, skin test and sublingual immune therapy, things along that line. And it really helps the patients a lot.
Yeah, I use the sublingual a lot now because it's easy. You can travel with it and low
Yeah.
risk of anaphylaxis, and but the compliance can be the issue, right? So,
I
yeah.
know. But I'm amazed how the patients can improve after a couple of months with sublingual immune therapy. It's incredible. I mean, and you can really see how they improve, and they're very thankful
Yeah.
because they can breathe, they can sleep better, they feel better, refreshed.
One more topic I want to touch on is peanut allergies and the rise in peanut allergies, and why do you think that is? And can I've seen people doing immunotherapy for peanuts, but then it seems like it's a huge undertaking and not very effective. So, what are your thoughts?
It's a real thing. It's happening. It's been rising in the last 5 years, 10 years, the last 10 years, and I think it's related to the vaccines
Right, right. So it
at some point.
because now they're saying, oh, well, it's just because parents are so paranoid and they don't give their children peanut butter early enough, and that's why. So,
There are some articles out there that they say that the early exposure of peanut to patients that they have a family history of peanut allergy, it's better. And I do believe that, but
mhm.
obviously under medical supervision and things like that. But why are we starting to see this rise in allergic disease that we didn't see 25, 30, 45 years ago? I really think a lot of different things that we are seeing there are related to the huge increase in vaccination.
What about SIDS? Are you seeing a rise in SIDS, and do you think that's vaccine related?
I don't see I haven't seen cases lately because I'm more after the spectrum of SIDS, which is virtually in the first month of life.
Mm-hmm.
I see like older kids,
Mm-hmm.
but I we know that SIDS definitely there's a lot of big correlation with vaccines. When I was in my pediatric residency, when you're starting to read about SIDS, it was like, wow, what is this?
Mm-hmm.
This is something, I mean, what happened? So the kid was perfect. It was developing perfect. Everything was perfect. And then all of a sudden, unfortunately, he didn't wake up the following day. What happened? But it was the way it was on the textbooks and everything. It was like, well, this is something that no one knows. But it was hard to make the connection 20 something years ago or whatever, the connection with the vaccines. But I knew something was wrong.
Mm-hmm. Mm-hmm.
Now I know for a fact.
What about the food, and do you feel like the processed food is a huge problem that could be leading to a lot of these issues in terms of, well, obesity, but just being sick all the time, and more allergies and things of that nature? Or do you feel like we really just need to focus on the vaccines?
No, definitely it's what we call multifactorial. So food, it's related definitely. And vaccines, there's no question in my mind that there's some correlation or a lot of correlation with this. And obviously, if we put in a general context, we have to include microplastics, nanoplastics, pesticides like glyphosate and things like that. So all this contamination through a food source and water, it's definitely changing our health.
Mm-hmm. Yeah.
I mean, if you see the statistics of cancer 40 years ago versus the microwave, including, so 40 years ago versus now, I mean, cancer, it's all over the place. And I know for a fact that definitely the COVID shots, it's directly related to these turbo cancers
Mm.
from glioma, brain cancers, colon cancers, breast cancers, lung cancers, and so on. We're starting to see a rise in all these terrible cancers, even in very young patients. Pancreatic cancers in 13-year-olds. I mean, you haven't
Yeah.
we never seen anything like that, but we're starting to see this because it was gene therapy.
Yeah.
Besides it was toxic injectable products, it was gene therapy. So it modulates and it modifies the DNA.
Well, the CDC has not updated their cancer data since 2022. So it's, we're all screaming that, yes, we're seeing a huge rise in cancers, but our own government seems to be hiding that data, which is unfortunate.
And one of the things that I know for a fact that we need more brave doctors like yourself, like many other doctors that they are raising their voices, standing out, being brave despite the circumstances, despite the outcomes, despite losing your license, losing your job, losing your integrity. So I echo what the incredible work you have done, Dr. Golan. I'm very proud of you and many others of our colleagues that we need more doctors like yourself to raise their voices and be brave and because at the end of the day, we became doctors to help people. And the Hippocratic Oath that it's primum non nocere. First, do not do harm.
Yeah. Well, thank you. And I know you are working with the Wellness Company, which is a great source for ivermectin. I don't know, there are 5 states now that have ivermectin over the counter, but it's still a struggle, even in the states where it's doesn't require a doctor's prescription. From what I understand, it's still sort of a battle to get it because you got to find a pharmacist who's willing to do it. So the Wellness Company does provide ivermectin, which is a great a great tool for people to have, and you can get it all over the country. So, where can people find you, Dr. Diaz?
They can find me on my X account at Alejandro Diaz, MD, and on my Substack, Biopolitics, that actually I will be um, doing an article within the next days about alpha gal syndrome, and I think it's going to be very interesting.
Great. I'll post our interview on Substack too, and I'll tag you, and we can collaborate on that. So that'd be wonderful.
Definitely, it will be my honor.
Well, this was very interesting. We got a lot in this hour. I really appreciate you coming on, and we'll have you back